if you're ADHD, it doesn't necessarily mean that you're dumb. It just means that society has been structured only for one, with like school and the 9-to-5 life. You know what I'm talking about? Like, it's only been structured to fit like one brain, and the ADHD brain doesn't fit into that.
Yeah, ADHD brains are what we consider maybe, I don't know if you heard the kind of newer term, neurodivergent.
No, what does that mean?
It's just that their neurons are wired in a little different way than maybe the average person, so diverges from what we would think of as a standard human brain. So you're right, it's because they're neurodivergent, or people with ADHD probably could be considered neurodivergent, that they don't fit that structure of corporate life, of being in school, most of the day, all day, Monday through Friday, and kind of that really heavily structured environment.
This is so fascinating. This is something I could get hyperactive on, and we could just sit here and record for the next 3 days. I'm going to hold you hostage.
So I probably have to go to work pretty soon.
Damn it.
It's like as in this week. So
no. All delulu besties, welcome. This is a safe space to vent, talk shit, reflect, and most importantly, keep it real. It's better to trauma dump here so that we don't explode on innocent randos. Just admit it. You're bothered. What's up, delulu besties? Welcome back to another episode of Balancing the Bullshit. You guys, today we have a special treat. We're meeting with psychiatrist Dr. Lulla. He's been in practice for 10 years, and he specializes in treating mental illnesses such as depression, anxiety disorders, substance abuse, and schizophrenia. Currently, he's working for the VA here in Austin, Texas, and little disclaimer.
Yeah, well, first off, Karen, thanks for having me on the podcast. Happy to be here. Yeah, a little disclaimer is that I'm just here on my own accord today and just talking from my own perspectives and opinions and expressing my own thoughts and opinions on mental health care, and my views don't represent the VA. Okay,
so before we get into it, I have a few get-to-know-you questions.
Sure, fire away.
What was your first job ever?
My first job, like ever?
Yeah.
Or, so not in medicine.
Yeah.
It's still a nerdy job though. I guess I'm just a full-on nerd. I'll embrace it. But my first job was back in high school when I worked in an environmental science lab, and so it doesn't sound very exciting, but it actually kind of was. We got to go out to like the different, I grew up in the Houston area, and we got to go out to the different wetlands and swamps out there and collect like fish and little shrimp and like little biological specimens, basically living specimens, and take them back to the lab and put them in our tanks and do different types of research on them. So that was pretty neat.
And you were doing research in high school?
Yeah, I mean, nothing too high level, but
what the fuck? I didn't even know high schoolers could do that.
Yeah, I mean, I wasn't doing anything too high level. I was just collecting shrimp and stuff out in the bayous and stuff of Houston, but it was a pretty cool job to actually get to see how science works when I was just in high school. So
that's crazy.
Yeah, and so that kind of sparked, even though it's very different than what I do now, to be sure, but that kind of sparked my interest in science in general, I would say.
Wow, so. I worked in restaurants in high school.
Hey, everybody.
Totally different world.
Everybody has different backgrounds and different experiences, right? So
true. Okay, what's something valuable you've learned during your career?
Oh, good question. I would say, especially as it relates to my job as a psychiatrist and mental health care, keeping an open mind and hearing what people have to say, hearing them out, really, truly listening to people, getting to know their stories and their backgrounds and experiences, because you never know, first off, what you'll learn from someone else. Second off, keeping that open mind is really, really critical as far as just learning about the world and developing a more kind of balanced view of the world, I would say. So I think I've learned to just be a good listener, an active listener, and give everyone, the time and the effort and the patience to kind of hear them out and express themselves.
I love that so much. And okay, so I have my own psychiatrist that I meet with, and I've been pleasantly surprised by the level of care that he provides, because I don't know if it's just me, but I feel like psychiatrists, it seems so intimidating.
It can be, yeah.
And I've been surprised, by how open-minded he is. He listens to me, and because I know he's not a therapist, but I don't know how to explain it. I was kind of intimidated going in, thinking, oh, this is just science. He's going to be super nerdy, but he's so personable, but like scientific at the same time. It's so cool.
Yeah, I think it helps to have that personal touch and be able to really relate to your patients and kind of let them express themselves and understand where they're coming from. Because no two people are the same, and no two people or patients with depression are the same for schizophrenia or any mental health condition. So I think it's important to keep that in mind and really kind of understand where they're coming from and understand their life experiences, so that can help like direct their treatment or guide their treatment. So.
Yes. That is so true. Okay, so obviously I don't have schizophrenia, but that's kind of how I viewed it, as I'm going to come in and...
It could be depression, ADHD, anything. So.
Yeah, anything. Yeah. And that's how I kind of viewed it, like, oh my God, I'm coming in to see this like super smart scientific doctor and he's going to treat my craziness. But like, he's so relatable. We've talked about fuck boys, about the Austin culture. And I guess, to your point, the more that he gets me to open up, then the better he can understand me.
It's part of, we call it the therapeutic rapport. And that's just a fancy psychiatry or psychology term for developing that close, healthy rapport with and relationship with your patients. So and them with you, so that they trust your opinion and that they listen to what you have to say, and they, in my case, take the medication, like willfully and willingly take the medications and are compliant with their medications. Or in the case of a therapist, like a psychologist who's doing like talk therapy, they'll listen to the advice and feedback that they're getting through the therapy. So so it's really important.
No, it really is. And I mean, this is part of why I started the podcast and why I'm having you on. I am such an advocate for any type of mental health help, but really for psychiatrists. I want to destigmatize how intimidating it is, because there's so many people. Like, we would have such a better world if everybody had their own psychiatrist. It's really not as intimidating as it seems. Like, you don't have to be batshit crazy. They help anyone.
That's true.
Not anyone, but I mean, pretty much.
Yeah, like I see people who are really struggling and doing pretty poorly in terms of their mental health and need a lot of help, but I also see people who are probably more like you, just need a little bit of help here or there sometimes. Okay,
how do you view mental health? Because now that I have a psychiatrist, I just view it, because that also sounds very intimidating, but now I just view it as like you're keeping your mind healthy.
Yeah, it's a good way to look at it, Karen, because it's almost like a car. You have to do regular maintenance on a car, get the oil changed, get the tires rotated, all that good stuff. I mean, the human brain is a little more, I would say, complex or involved than a car, but maybe not. Maybe a mechanic would disagree with me, but I mean, they certainly work very differently. But yes, just like to do regular maintenance on something like a car, it's probably a good idea to do that for your brain too, or your mind, the kind of mental aspect of your body. So.
Yeah, I love that, because that is the work that I do with my psychiatrist to treat my ADHD. I feel like that's the perfect way to describe it. We're just enhancing my mind to make it operate at optimum level.
Giving it a little tune-up every now and then.
Yeah. Right? Okay, what's number one on your bucket list?
Number one on my bucket list. That's a good question. Can I make it really broad and say travel more? Travel, see the world?
Yeah. So. Do you get to travel a lot? Because I feel like doctors are always working.
I don't have it so bad, and I would say, and my colleagues in general in psychiatry, mental health care, we don't have it so bad in that we work long hours at times, but it's not maybe as excessive as some of the other specialties. Like I really appreciate and don't envy surgeons, because they're kind of working away, toiling away in the OR, the operating room, large portions of the day. So day and night, sometimes 24/7, 365, or practically 365.
Yeah.
So I don't have it too bad as far as that is concerned. But I mean, doctors don't have a lot of free time, generally speaking. But to answer your question, I don't really have a lot of time to travel. But I'm hoping as I get into a little bit later stages of my career, I'll have a little bit more time to do that and more leave time to take off from work and be able to do that. So.
Where's the first place you're going to go?
I knew you were going to ask that, so I was trying to think about that while I was talking. Do
you want to know my place where I want to go?
Yeah, let's hear yours first.
Africa. I want to do a safari tour.
I was just talking about going on wanting to go on a safari with another friend, actually.
Oh my God! How funny!
So Africa would be wonderful. That's top of my. Probably I'd have to put Thailand a little bit ahead of that.
Yes,
just because I love Thai food. I love the culture, the food. The people that I've met here in the States, at least, seem so warm and welcoming and friendly. So Thailand is probably probably at the top of my list. Then Africa, number 2 maybe.
Okay, yeah, same. Thailand's my number 2. Are you spiritual or into Buddhism at all? Because I know they're big in that in Thailand.
I'm spiritual. I'm not super knowledgeable about Buddhism specifically, but I think seeing the temples and the shrines there would be really cool.
So cool. Yeah, that's why I want to go. Especially after getting into yoga a few years ago. That's what kind of began my spiritual Buddhism journey.
Yeah, oh, that's awesome.
Yeah.
You should go.
Okay, so going all the way to death.
From the happy stuff about traveling and seeing the world and eat, pray, love, and all that stuff.
Now to death.
I love it, Karen. Nice transition.
What would you like people to remember you for?
Oh, that's a tough one. Yeah, see, I'm only 39. That's a question I feel like it's going to age me or something, because that's like maybe better asked of an older psychiatrist.
Okay, like, what if you die tomorrow in a car accident?
Yeah, you never know. That's true. Yeah, so what a happy thought. Yeah. No, but in all seriousness, that's a great question. I would say, I mean, just probably the general things that maybe a lot of people or most people want to be remembered for. Like, I want to be remembered as hopefully just a good, thoughtful, caring human being. Who genuinely loved his family and friends and was good to them. Hopefully they would think that of me when I die. And then also, as far as maybe professional, that I was a good psychiatrist, that I really gave my all and gave my best effort to my patients, and hopefully bettered their lives, at least in some small way, shape, or form. Just generally those things.
Oh, I love that.
So, because I mean, no one is perfect, so I'm not expecting people to remember me as some flawless person. But yeah, just generally someone who gave his best to his family, his friends, and his patients. So, yeah. I've
had to learn that the hard way, because I started my career, and I don't know if this is just a part of normal going through your 20s, because I'm 29, but I've been in sales for the last 8-9 years, and so I was so focused on my exterior, what people saw of me. Like, I just wanted people to see me as successful, and I made a lot of money and made something of myself. And now that I got to the point where I was like, wait, I'm so miserable even after making money. And now getting away from that, I've realized everything you just said. What's actually important in life is being a good person, being a good friend, family member if I ever have kids, being good to my family, and just being remembered for helping people in my career. It's not anything about the shiny, successful title or anything.
Exactly. Yeah. Those things don't last. So the things that last are making a difference in the world and having people remember you for making that difference, right?
Oh, I love that. We're ready to die now.
Don't say that. So dark. Many years from now, right?
Okay. Do you have any toxic traits you're not proud of?
You're just going to you go from the dark question to the negative toxic question, huh?
We're getting to know you all around.
Yeah, that's fair. Maybe a little too well. Your viewers are going to be like, wow, this guy, he's a character. So, toxic trait. Well, probably what just happened before we started recording, that I was running a little late on you today. I'm not the most punctual person. I don't know if that's a toxic trait, but it's a bad habit that I need to work on. It's being more punctual and being more respectful of. I mean, I try to be respectful of people's time, but it's definitely something I could work on. And my excuse is, I'm a busy physician type. I'm a busy doctor type. It's okay for me to run late because I have a lot of things to do, usually important things to do. But still, I can understand how that could be considered disrespectful of other people's time. So that's definitely something I'm working on for myself. I'm not sure if that's quite toxic, but I guess it could be.
Oh, for sure. That's a toxic trait.
You think so?
Okay, I dated a guy.
Call me out on that.
No, okay, this is actually a really good answer. I dated a guy, and his was so bad, and he ended up admitting that I put him in a position to like go get on a high. How did he explain?
Yeah. I think I get that too a little bit.
The pressure, is that why you subconsciously do it?
Like the adrenaline rush to try to get there. Yeah, I think I kind of like that. So, but
that's interesting.
That's not a good. I mean, I guess people seek adrenaline rushes in different ways. Some people go skydiving or something, but maybe for me, it's just, not to compare it to skydiving, but it's definitely a lower level adrenaline rush than that, I'm sure. But I've never been, but I'm sure it's less than that. But yeah, maybe that pressure to have to get there, have to like rush at the last second to get there and try to make up time, basically.
Yeah. And then also, this was all a subconscious thing, obviously, but the fact that you're walking into a room like, oh, sorry, I'm so busy, then it kind of feeds your ego.
Yeah, I think that's part of it. So
isn't that interesting that we do all these things without even realizing it consciously?
And I'm a mental health professional. I should be more aware of what I'm doing, aware of my own behaviors. Maybe I'm so busy thinking about other people's behaviors, I don't always turn that eye inward, so to speak, turn my viewpoint inward or be more introspective about that. So I'm definitely working on that. And my apologies for for keeping you waiting a little bit this afternoon. So.
Oh, no, it was 15 minutes. It was not bad at
not
all.
like the toxic boyfriend who was maybe like an hour or something.
Oh, yeah, no, his was so bad. It was annoying. I was like, okay, we're done now.
Yeah, that's fair.
I can't, yeah.
Glad you moved on from that relationship, though.
Oh, yeah, same. So, pretty much going back to what I was saying earlier about just why I'm so passionate about mental health is because when you think of mental health, I feel like it sounds like such a scary, daunting word, and people always gaslight themselves. When I was ADD, I didn't get diagnosed until my early 20s, and so, for example, in college, I would study for so many hours and then go fail my test. I somehow managed to graduate. I feel like I barely did, and then in my adulthood, it was so hard with my career. I would work like 80 hours and I wasn't hitting quota, so then I wasn't really making money, and I just thought, now going back, I'm like, oh damn, I was gaslighting myself, but at the time I just thought, oh well, this is just a part of your early career, and everybody else must study for so long.
Just regular life struggles, right?
Yeah.
School or work struggles, yeah.
Yeah, and granted, it's only ADHD for me, but then once I got diagnosed, it just opened my mind to, damn, what about all the people that are struggling with schizophrenia or bipolar, more intense things? I wonder if they also gaslight themselves, because the way that my psychiatrist explained it to me was, and tell me if you agree with this, but the hardest thing with diagnosing people for mental health is they only know their own brain, and so they don't know that other people's brains function differently. They don't realize that they don't have to struggle as much as they do, and that other people don't struggle the way that they do.
Yeah, no, I completely agree with that. I think that's a really good way to put it. So, and really insightful observation that your psychiatrist made. And because, everyone's brains are wired a little bit differently, or maybe not even, maybe wiring is not the right way to use, just their chemical balances or chemical amounts of the neurotransmitters in the brain can be a little bit different. So you're right that someone who has bipolar disorder or schizophrenia or severe mental illness, their brain is just working pretty differently than maybe someone who doesn't have a severe mental illness like that. And same with a person with ADHD like yourself. Your brain works a little differently than someone who doesn't have ADHD. Yet ADHD is not really considered, like you said, a severe. It's a serious mental illness, or mental disorder, but it's not as severe as something like schizophrenia. But that being said, there's still a difference between a person's brain with ADHD versus a person's brain who does not have ADHD. Yeah. So it's important to understand these differences and realize that that I should seek treatment if I'm having some mental health problems or some behavioral health problems, because there are people out there that their brain is working differently, and maybe they're able to have a more productive life because their brain is not struggling in the ways that maybe someone with ADHD is, or certainly someone with schizophrenia would be, that sort of thing. So.
And okay, can we talk about ADHD, because I feel like that might be more common than schizophrenia or bipolar?
Sure, it probably is. Yeah.
How would you describe it? I know the dumbed down version I understood was my psychiatrist said, don't we have more of the creative, whatever they're called, versus the logical thing in our brain?
Neurons.
Yeah, okay, can you explain it?
So ADHD is still not all that well understood. It's the pathophysiology, which is the big fancy term for the root cause, the underlying cause of ADHD has not been fully clarified, or we're not sure exactly what causes ADHD, but generally there's some thoughts that it is an imbalance of the neurotransmitters in your brain. So these little chemical signals that the neurons and nerve cells in your brain give off. And there's a thought that it involves two different chemicals in the brain. Dopamine, which is really important for your feeling a reward, or like a rewarding sense after you do any activity, but whether it be eat a good meal or have sex or complete a homework assignment like in school. So there's some thought that dopamine is too low in patients with ADHD. The dopamine levels in their brain, and the nerve cells and neurons that make up the brain. So because the dopamine, that reward chemical, is too low, the dopamine chemical is too low, they don't get the same sense of accomplishment when they complete a homework assignment or complete a job task at work. So that's why that's at least a thought. It's not been completely proven, like I was saying. They still haven't elucidated the cause. Again, fancy way of like figuring out the cause. But that's the thought as to why patients with ADHD, individuals with ADHD like yourself, are not able to stay on task because they're not getting that same sense of rewarding feeling from completing a task. So they get kind of easily sidetracked and go every which way with their activities, with their behaviors. So that's part of it. And then the other chemical is Are you having an epiphany over there?
Yeah, you're blowing my mind. I'm like, okay, that makes so much sense because especially when it comes to a big thing and I see other people like, oh, they would go out and celebrate this type of an accomplishment in their career or life, whatever. And I'm like, okay, whatever, let's move on. I almost forget that that's a big accomplishment.
Yeah,
I never knew that was why. Yeah.
Because you probably, so you probably weren't getting, you or anyone with ADHD, not to pick on you, of course, Karen, you're not getting that sense of basically pride or reward from that big accomplishment.
Shit.
Or it could even be that's a big example that you're giving, which is a great one. But you could take it to a smaller level and say, like even just completing a homework assignment, like back when you were in college, or younger than that, even like your high school years, whenever, or you're doing a good job on a test, or like coming out of the test knowing that you probably did well with it, or actually getting a score back and seeing that you did well on your test. I mean, you probably felt okay about that, but like didn't get that really nice natural high that maybe most people get.
Never. I'm like, okay, on to the next.
The other thing I'll mention real quickly about ADHD, the other chemical involved in that's too low again for patients with ADHD is norepinephrine, which is the newer, fancier word for adrenaline, basically. So it can be too high or too low. So we think that the problems with the levels of that cause some of the inattention, but also in some cases the hyperactivity that some patients with ADHD have. Yeah, like the hyperactivity part of ADHD. So
it is crazy because it's so hard for me to sit down and actually focus on something. But then if it does happen, I get so hyperactive that like I won't eat for hours. I just get so focused, and then my whole day goes by, and I'm like, oh shit, I'm just done. And it's not even just day. I'll spend a whole phase, like a few weeks or something, on just one thing, which is good and bad. I think tell me, because this is kind of my own theory, but I think that's part of the reason why I haven't been good for corporate America and why I'm probably going to do way better as an entrepreneur, because like the way that I've been building out my business is when I have those hyperactive moments. This was about a year ago now, but when I wrote my book, it was like one of those hyperactive moments where I just took 3 days, I think, and I just knocked it out, and then I had a whole book. But then I didn't do anything for months after that. And then same thing, then I built on top of that and built a coaching program, and it was same thing. Like I was hyperactive for maybe a week or two. So I'm able to get it done a lot faster than I guess a normal person, quote unquote, or whatever. But then after that, I didn't do anything for weeks. And like, you can't do that in corporate life.
Yeah. So you were probably having those drops in your dopamine and norepinephrine, or adrenaline, to use the kind of more commonly used term. And this after those periods of really like high level of productivity, you kind of just burnt out those chemicals. Your neurons in your brain are a little bit burnt out. And you just couldn't do anything for a little while. So that there's so people with ADHD do go through those kind of highs and lows of productivity. So that can be part of the disorder, if you want to call it that. So
this is why I love so much having a psychiatrist, because it's all these things that I don't ever think about, but then when I sit down to talk to him, just like my normal day-to-day behavior, then he explains to me why my behavior is actually going along with my brain, and I'm like,
what's causing your behaviors, right? What's causing you to act, think, feel the way that you are, right? That you're doing. So,
and you know what he said to me once? You could also probably explain this a lot better than the way I'll make it sound, but something along the lines of, if you're ADHD, it doesn't necessarily mean that you're dumb. It just means that society has been structured only for one, with like school and the 9-to-5 life. You know what I'm talking about? Like, it's only been structured to fit like one brain, and the ADHD brain doesn't fit into that.
ADHD brains are what we consider, maybe, I don't know if you heard the kind of newer term, neurodivergent.
No, what does that mean?
It's just that their neurons are wired in a little different way than maybe the average person, so diverges from what we would think of as a standard human brain. So you're right, it's because they're neurodivergent, or people with ADHD probably could be considered neurodivergent, that they don't fit that structure of corporate life, of being in school, most of the day, all day, Monday through Friday, and kind of that really heavily structured environment.
I can't stand structure. It turns me into a crazy person.
Yeah, that's what you were telling me. So that's why you left the corporate world, right? So you probably just are someone. I mean, you don't have to have ADHD to just not to be neurodivergent, or to not be not do well in structured environments, but people with ADHD do tend to be those that don't do well with structure. So maybe because of their struggles with focus and concentration, but then also with maybe some component of hyperactivity. All that, the hyperactivity part is supposed to kind of subside as we get older, or in patients with ADHD, it's supposed to subside and get better as they get older. But it still comes across as maybe being unable to focus on one task at a time and completing that task, and kind of just jumping from task to task. That's kind of where the hyperactivity shows up more. Like you're saying, super productive on writing a book in 3 days, which is super impressive. So that was, instead of like you're not going out there and running 5 miles every day, that kind of hyperactivity, but like or running a marathon every day or something. But instead you were just being super hyperactive about finishing your book in 3 days. But then you had that crash and you didn't do anything with it after that, right? Which is also pretty and kind of, or maybe at some point they're moving on to other tasks and kind of forgetting about the book.
Yes,
that's very common with with ADHD, with patients with ADHD too. So,
which when I look at it, I feel like the way, and again, I feel like everything I say about myself sounds crazy. And this is why I love psychiatry, because you guys make me feel not so crazy.
Normalize it, which is what we're here for. That's part of the like treatment process, treatment or healing process, you could say.
Oh, yeah, it is very healing. I feel like meeting with my psychiatrist, yes, obviously he's giving me medication, but it's helping me just understand myself better, which is helping me heal, because I came in thinking, oh, I'm dumb, why am I not as smart as other people? But anyway,
some of the smartest people, I didn't mean to cut you off, Karen.
No,
I was going to say some of the smartest people I've ever met, or I've met a lot of smart people being in medicine and being in healthcare, are people with ADHD, patients with ADHD.
Really?
So, or even my colleagues and coworkers, former medical school classmates and so on, a lot of them had ADHD and they're just brilliant. A lot of them are brilliant people. They just have this condition, have this disorder that causes them some difficulty and some struggles, but it doesn't mean they're any less capable or smart. They're just as smart, in some cases smarter than people without ADHD. So.
Oh, wow. I bet it just took them understanding themselves and how their brain worked in order for them to get through medical school.
Yeah, and getting the proper diagnosis, because ADHD can be missed. It can be undiagnosed or underdiagnosed in children, especially if maybe like the parents of the child are not super into or keen on mental health. Don't think mental health is quote real, or there's actual mental health problems that can affect their child, that sort of thing. So that child with ADHD may not get diagnosed at all until they're 18, 20 years old, even older than that sometimes. So
yeah, that's what happened with me. I come from Mexico City, which they're like very Catholic and just old school and traditional, which there's a lot of benefits to that. But one of them is, they don't believe in mental health.
Yeah, they don't prioritize mental health. I don't know if I told you this. My dad's side of the family is from India originally.
Oh, cool.
And so they had that same perspective on things, kind of old world culture, and not so into mental health, and just kind of the whole suck it up, you'll be fine mentality that a lot of other cultures have. American culture has it too to some extent, but definitely these kind of older cultures, older countries have that. So.
Oh, thank you so much for being here, because this is why it's so personal to me, because I'm like, no, I need to get this out to the world and everybody, all these cultures, to hear me. Like, this is a real thing, and help your kids. But what I was going to say is, now that I have been giving myself a chance to just listen to myself, like, okay, if this structure is driving you crazy, let's try to figure out a different structure. And something I've noticed about the way that I work, even with the way that I wrote my book, it's like I do seem very scatterbrained, and it's almost like creating art. And I think that's how I'm even building out my business too. Like, it doesn't make sense. It's like I'll like splatter a paint and like splatter a dot here and bring up one, and then at the end I tie it all together.
And it's a masterpiece, right?
Yes, you get it.
So.
But I mean, yeah, again, corporate life, or to anybody else trying to go to school, it's like, no,
Karen.
Like, no, Karen,
you got to focus on the task at hand and start at point A and go to point B and straight line through, and
and I'm like, what?
Can't throw paint on the wall and just see what happens. You have to have a very linear way of thinking.
Yes,
and
so
that doesn't fit the ADHD brain. And medications can and absolutely do help with that, and get their thought processes to be more organized and more linear thinking, and better able to focus on the task at hand for task completion in their work environment or school environment. But it's also a problem if the person loses that creativity. We don't want the medication. I tell my patients all the time that I don't want you to lose your creative side of you, your creative personality, if you will, creative part of your brain, although it's not really one part of the brain for that, but just that creative side to your personality. We don't want you to lose that by way of over medicating you or medicating you with the wrong medications. That's going to dull that creativity. So it's finding that balance of allowing the person to be the creative, unique, expressive individual that they are, and putting that forth into the world, and creating beautiful, wonderful products for the world with that creative side, but also managing the ADHD symptoms where they can actually focus and get that creative view expressed and in a logical, coherent manner to the world, for the world to see and understand and appreciate.
Andy, I just want to hug you and cry. No, this is seriously so sweet, because this is another thing that I struggled with, where in corporate life, for so long, I was like, I don't know why, but I just feel like I can't be creative. I don't see how to ever find a creative role that's going to like bring me sanity, which is so hard, because corporate life is what you do. It's what everybody does. And I feel like this is also what my psychiatrist has somehow just helped me. I feel like I'm now finding a career where I can bring logic into it, which is like the medicine is helping me do that, but also he's bringing out my creative side, and I love all psychiatrists so much.
Thank you. Well, that's
no, thank you.
I mean, it's not us. It's kind of, I think we're just like the vessels, if you want to call it that. We have certain training, and so we're able to help people in these ways. So, is
there a cure for ADHD, or am I just gonna have to be on medicine forever?
So there's no. So from just to take it out like broader, from like the broader perspective, there's really not any cure for most mental health conditions, mental illnesses, if you want to call them that.
Interesting.
Unfortunately, it's more psychiatry. In psychiatry, we more so kind of manage symptoms with medication. Hopefully that'll change one day, and I think maybe it will change at some point, and hopefully within our lifetimes. So you're younger than me. Hopefully at least within your lifetime, that we'll actually have some treatments that are actually cures for these different conditions. But as it stands right now, the modern state of psychiatry and psychology, we don't have, or mental health care in general, we don't have just outright cures at this point. So, but we do have pretty effective, as I think you've experienced, pretty effective medications to treat most conditions. Pretty much all conditions we have, any and all mental health conditions you can think of, we have at least some medications to treat, and a lot of the time they are effective in terms of helping the patient manage the symptoms, where they can, maybe they still have symptoms from time to time, or still have some lingering problems, but by and large they're living a lot more like mentally healthier life, and more productive, more creative life, all those sorts of things. So
that actually makes sense. Like, it wouldn't make sense if there was a cure in a way, because what we were just saying, it's not that there's anything wrong with our brains, they're just different.
They're just different,
and
yeah.
there are
they're
good
working
things
a little
to
differently.
it. Yeah, like we can be hyperactive and can be creative, so like, why do we have to change that?
Yeah.
We can just learn ourselves better and how our brain works.
Exactly, Karen, and that's what we were talking about earlier, touched on earlier. Like, I don't want any of my patients or anyone that I'm working with to feel like the medications are fundamentally changing who they. I mean, sure, we're managing symptoms and we're getting things under better control, so the person can be a better version of themselves, maybe, and not have the disorder, like whether it be ADHD or any other depression, whatever it may be, where it's not dragging them down and preventing them from being the best. You could say best. I know it's a popular phrase these days, but best version of themselves.
Yeah.
So that's the goal. But I don't want my medications, or I don't think any psychiatrist wants the medications they're prescribing to their patients to fundamentally alter or change the person's personality, where they're not as creative, not as loving, caring, and those sorts of things. Like, kind of, I have had patients tell me that they're usually not ADHD meds, but they're antidepressants maybe are making them feel kind of emotionally dull or numb.
I've heard that.
So I think that is a real thing. I don't think they're just telling me that because they don't want to take pills or something. So that's the problem. I don't want, and I consider that a side effect, an adverse effect of the medication. So in that case, we stop the medication and try something different, try a different one, or if they haven't tolerated a few different meds, we maybe just say we need to go a different route, like talk therapy or mental health counseling or coaching, that sort of thing. Because I don't want my patients to fundamentally feel like they're different. They're like a different, maybe / worse person because of the medication. We want the medications to help control symptoms and help more than it's hurting, and as far as just improving their symptoms or minimizing their symptoms, where they can be the best version of themselves, like I was saying.
Okay, going back to the brain for ADHD and depression, is it, because when you think of you're depressed, it could be situational, like something going on in your life. So absolutely. Does something happen in our wires to where they get rewired from a trauma response, or our brains just we're born with our brains this way?
That's a really good question. That's the $1 million, or it's 2024, so $1 million is not a lot. So multi-million dollar, $1 billion question. I don't know. And I think that hits on the whole nature versus nurture argument. Have you heard about that? Or
I don't think so.
Discussed that with anyone before? Or learned about it like in your college classes or anything? So all that is nature versus nurture means like, so nature is kind of who we are. It's the genes we get from we inherit from our parents, and down through the generations our grandparents gave genetic makeup to their genetics to our parents, and so on. So nature is just kind of who we are based off of our genes, off of our family heritage, and most importantly our parents. So some of that cannot be changed. That's just who we are. It's in our blood is the expression, or it's in our genes. So some of that is maybe hardwired into our brains as they develop and as we get older. But then the nurture part is your upbringing. It's how you were raised. So if there were traumatic experiences that occurred in a person's childhood, like abusive situations, those sorts of things, then that can affect especially, it can affect your brain at any age if you go through a traumatic experience, but your brain is still forming and developing when you're a child. So it's very sensitive at that point to any sort of experience, good, bad, or in between. But definitely those bad experiences can kind of change the way that their developing brain is formed. There's actually research that shows that different parts of the brain are different sizes, smaller than they should be, that sort of thing, because patients had experienced trauma at an early age. So it can absolutely affect the physical development of your brain, but also those chemical balances that we talked about, or like the dopamine and all that we're talking about with ADHD involvement. So it's both. It probably is both, honestly, like nature and like the genes you're getting from your parents and how you're born, basically, but also how your childhood and adolescence, how your upbringing went, and what experiences you had during that period of your life.
Okay, I'm so glad I asked you this, because I don't know if my psychiatrist told me this, or if because I'm obsessed with therapy, psychology, everything, so I don't know if I've just made this up or read it at some point and if it's actually true or not. But for the longest time, I've been wondering because I had a pretty traumatic childhood with my parents' divorce, and I had to start doing therapy at a young age because of that.
I see.
My dad was a narcissist. So I don't know because I heard somewhere along the lines of when your brain is developing as a kid and then you experience trauma, rather than your brain continuing to develop in a normal way, and then almost has to like shift gears and then go into protection mode. And so maybe my psychiatrist did tell me this, but something like that might have been how I then turned ADHD. Am I crazy?
You're right. It's like going into a protection mode, or trauma response is what we call it. So, or what maybe more like what psychologists use that phrase. Psychiatrists and psychologists have a lot of common terminology. So yeah, you go into this trauma, you experience a trauma response from that traumatic experience, and your brain development, if the person is still young and still a child or adolescent, the brain development shifts or changes. Again, the brain chemistry, the chemical levels in the brain of these different neurotransmitters, these chemical signals in the brain can change or become a little bit imbalanced, even because the brain is entering this kind of trauma response mode, which is basically, like you, I think, very very accurately put it, like a protective mode, and trying to just go into like a survival mode would be another way to put it.
Yeah.
And just trying to get through whatever bad experience just happened, and trying to just help the person. The brain is trying to help the whole person survive, basically, and make it through.
So then, is there ever a point where, when you teach your brain after so much therapy, like, okay, we're safe now, we don't have to be in fight or flight response anymore, does your brain then at that point finish developing, and then ADHD goes away? Or I know we just said it's not curable. Yeah,
there's some thought that once those changes happen, it's very hard to reverse them. Medications can help control any symptoms caused by those trauma response changes. Therapy can help with that too, but unless you undergo a lot of treatment right as that's happening, or soon after that happens, it's probably very difficult, if not next to impossible, to reverse those changes, unfortunately. So that's why most people who experience trauma at an early age, childhood trauma of any form, really, they do kind of struggle with the after effects of that trauma, the consequences of that trauma for the better part of the rest of their life, if not the rest of their life entirely.
Damn.
So
this is another reason why I'm so big about doing this podcast and just like trying to help educate as many people, because one of my biggest pet peeves in life is how just anybody can become a parent. Like, there are so many people. It could be as little as mom and dad always being stressed out over, trying to put food on the table, and all that money stress then bleeds into the relationship stress, and then the kids don't get enough love, and people don't realize how that affects the child's development.
Yeah.
Like, it fucks you up.
Yeah, that's true. So yeah, and a lot of parents, a lot of parents are well intentioned, and they're trying to just provide for their families and for themselves and their kids. But yeah, those things can definitely, kids pick up on everything, as we know, right? Like,
yes.
They're always watching everything that especially, everyone, they're watching everyone all the time, especially adults or people they consider their role models, like the parents. The kids' first role model or role models are their parents, right? Their mom and dad. So yeah, any sort of like discord and disagreement in the arguments in the relationship or stress can negatively affect the child. Now, if it's relatively minor, like it's just a few arguments here or there, or it's things it's like arguments about money, like the example that you used. That's stressful to the kid, and they're going to pick up on that. So it's not great, but that I would say is maybe not as harmful or having as severe of an impact as something like abusive situations, whether it be physical, sexual, emotional abuse, neglect, those sorts of things. Those are the really kind of serious and detrimental trauma experiences that a child can go through. So like the money argument, sure, it's not great to that's kind of not being a good role model to your kids, to have a big argument about money in front of them, right? And they probably will remember that for the rest of their life. That mom and dad had a big blow up argument when I was 8 about money, and I remember that still, and I'm whatever. So not me personally, but I'm saying just an example. So that's not healthy, but that's maybe not nearly as
like what we're talking
severe
about.
as childhood physical abuse or sexual abuse, those kinds of things. Because just like anything in life, there's a kind of spectrum. There's a range of experiences. So there's more severe ones and less severe ones, or more milder ones. So, but you're right, anything and everything can affect a child, basically. So that's why parenting is a very difficult thing, and it's it's probably the most important job that any adult can have, right?
Yeah. So. Especially when you hear about like serial killers or murderers, my first go-to is I actually feel bad for them, and then I wonder what kind of childhood they had to have ended up being this way.
Yeah.
It's not like that was their choice.
Yeah, a lot of, I'm not any expert on serial killers, but so there's an area of my field called forensic psychiatry that they specialize in studying the criminal mind, that sort of thing.
Cool.
So, which is a really cool area, I think. And I'm sure my colleagues in that area of my specialty would agree with me about what I'm about to say, which to my knowledge, most serial killers have had some sort of childhood or like early childhood trauma that was disruptive to their brain development, like we were talking about earlier. And so their brain didn't develop physically in the right way, but also the chemicals were off too. The chemical balance of the brain was thrown off, the brain chemistry. And there might have been some genetic predisposition, like we said, the whole just what you're born with, the nature side of the nature versus nurture argument. So there's probably a little bit of both at play, but definitely those childhood traumatic experiences kind of started the process of them developing these severely antisocial behaviors as far as becoming physically aggressive and harming people. So
this is so fascinating. This is something I could get hyperactive on, and we could just sit here and record for the next 3 days. I'm going to hold you hostage.
So I probably have to go to work pretty soon.
Damn it.
It's like as in this week. So
no. Listen up, delulu besties. If you want to learn all about manifesting and become a master at attracting anything you want in your life, check out my virtual manifesting masterclass, www.karen-rico.com/shop, or click in the link in the show notes. And if you want to watch me podcast every week, check out my YouTube channel at Balancing the Bullshit, or click on the link in the show notes.